Joseph will be doing my EKG checkoff. So I gathered my equipment and go ahead and knock on the door, do some hand hygiene. I'll close the curtains for some privacy. All right, hey, how are we doing, Mrs. Gee? My name is Joseph, I'll be your nurse today, and we're just gonna be doing an EKG on you because the providers ordered it. It's basically just a little picture of your heart that we're gonna get to make sure everything's working properly. It should be painless, and it should just take a couple minutes, okay? All right, do some more hand hygiene as I come over here, and I'm just gonna log into the EMR. Can you go ahead and tell me your name and date of birth, Mrs. Gee? All right, perfect. I'm going to check the wristband. Find Mrs. Gee on my patient chart. All right, and I'm gonna verify what she said. All right, that does match up. I'm gonna look at her wristband one more time. All right, MRN, name, date of birth, all that does add up. So this is the patient. Go to provider's orders. All right, and obtain stat 12 lead EKG. So we do have an order for this, so we can go ahead and proceed. So I'm gonna do some more hand hygiene. Go ahead and grab my glove. Mrs. Gee, I will have to expose you for this procedure. It should just take a minute. If you feel uncomfortable at any point, just let me know, okay? All right, so I'm gonna go ahead and bring this down. We'll go ahead and move this to working height. All right, and it's about waist level. Go ahead and bring the side rail down. All right, and I'm going to expose. I need to expose Mrs. Gee's thighs. I need to expose her chest area. All right, and now I'm going to go ahead and just note that I would do any skincare, such as shaving the patient or cleaning the area, but it does look good, so we can go ahead and proceed. So I'm going to go ahead and grab my leads and go ahead and start with my lead placement. So I'm going to find my landmark up on the suprasternal notch, and then go down to the angle of Louis from the second rib. So now I'm going to second intercostal space, third rib, third intercostal space, fourth rib, fourth intercostal space about right here. So now I'm going to go right at that sternal border, about right here. Now, find my landmark, fourth rib, left of the intercostal space. This is V2. That's V1. That's V1. That's V2. All right, fourth intercostal space right here, fifth rib, about fifth intercostal space about right here. This is V4. I'm gonna go ahead and find the mid-clavicular line, fifth intercostal space, displace the breast tissue, and then place it on the mid-clavicular line. That's V4. V3 goes in the middle of both of those, about right here. Find the fifth intercostal space again, find my landmark, and I'm gonna go anterior axillary line, about right here, displacing the breast tissue again, about right there. Now, last one is gonna be fifth intercostal space, mid axillary line, about right here. I'm sorry, I'm leaning over you, Mrs. Gee. All right, so those are all my V leads. Now I'm gonna find my limb leads. So I have my right upper around the bicep area facing downwards. I have my left upper bicep area facing downwards as well. Left lower, which is going to be facing upwards. The two lower ones are the only ones that are going to be facing upwards, avoiding bony prominences. And then my right lower right here, facing upwards, avoiding bony prominences. All right, and now I can go ahead and I'm going to attach these leads. And also, Mrs. Gee, I just want to go ahead and tell you, so I don't forget, during this procedure, I don't want you to cross your legs. I want you to keep them straight along with your arms. All right, so I'm gonna find my leads. I have my, I'm just gonna go ahead and set this on you, Mrs. Gee, okay? My left upper, so it's gonna be right here. Left upper. I have my right upper. I have my right lower. And then I have my left lower. All right, now I'm gonna grab my V leads. I'm gonna go ahead and find V1. V2. V3. 4. And then, sorry, I'm leaning over you again, Mrs. Gee. 5 and B6. Make sure everything's pressed down good. All right. And now that I have all my leads in place, again, Mrs. Gee, I'm gonna get you to keep those legs uncrossed, arms down in a supine position. Go ahead and open my EKG. Go ahead and power it on. All right, it's powered on now. And now I'm gonna assess for a rhythm. Rhythm looks good. All my placements are in place. And I can go ahead and press the EKG, or before I press the EKG machine, I'm just gonna go ahead and tell you, Mrs. Gee, you can breathe normally. Just stay still and don't talk for a second, okay? My rhythm's good. Press the EKG button. Now that I've pressed it, the EKG has been printed out. It's right here. You can go ahead and note I do see a identifiable baseline, and there's no artifact in it. The machine interpreted it as normal sinus rhythm, which is a regular finding. If it wasn't a regular finding, such as acute MI, I would go ahead and report that to the provider immediately. But since it is a regular finding, I can go ahead and place it in the patient's chart. All right, and that's the end of my procedure. So I'm gonna go ahead and take all these limb leads off, all these V leads. All right. Now I can just go ahead and put this back on my machine. Go ahead and take all these stickers off. It may hurt a little bit, Mrs. Gee, I'm sorry. Try to get them off quick. All right, and I would go ahead and clean the area as needed to get the sticky off and just to make sure Mrs. Gee is comfortable. I'm gonna go ahead and throw those in the trash. I'm going to get Mrs. Gee comfortable. Are you okay, Mrs. Gee? All right, perfect. Go ahead and get my side rails up. Open my EKG machine and turn it off. 3 side rails up. Now I'm gonna go ahead and put the bed in the lowest and locked position. Oh, my bad, I missed the lead. Alright, get in the lowest and locked position. Alright, and now I have my call light to the left of her. I'm gonna bring my EKG machine out. I'm gonna take my gloves off. Do some hand hygiene now and document my procedure. Alright, so I'll go ahead and document it in my we probably would just transfer over in my electronic record, but if not, I would place it in a physical copy if that's what you're doing. So I can go ahead and document it and log out. Mrs. Gee, do you have any questions from me? All right, well, then I would walk out of the room, gather my supplies, and do hand hygiene.